Hi, this is Betty Long, founder and CEO of Guardian Nurses Healthcare Advocates. Welcome to Season 7 of the Lighting Your Way podcast, a season in which I continue to talk with my Guardian Nurses colleagues and hear from them about their day-to-day support of our patients and clients. Their stories are heart-wrenching, uplifting, empowering, frightening, captivating, and true. Welcome to Season 7. In this week's episode, I talk with the Nursing All-Star team of Stephanie Wimmer and Heather Munizza. Heather and Steph support the men and women of District Council 21, which is a Philadelphia-based health and welfare fund, and they support them as their mobile care coordinator team. The work that the members do at District Council 21 does expose them to occasional environmental hazards. Fortunately, the Health and Welfare Fund covers many of the screenings. I can't stress enough how important listening to your gut can be, as well as getting the recommended screenings, as Steph and Heather's stories will recommend. Welcome to the Lighting Your Way podcast, Heather and Steph. It's a pleasure to finally have you both here.
Thanks for having us.
Thank you, Betty.
Yeah, getting the two of you together is like scheduling the president with your. You guys you're bopping around town, so I'm happy to have you. I think it's an important conversation that we talk about because you are the nurses on the mobile care coordinator team for the IUPAT District Council 21, and that is an acronym for the International Union of Painters and Allied Trades. So that's a lot, which is why we just call it DC 21. Steph, you're the senior member of this team. Can you explain for our listeners what the fund is, what the members do?
Sure. So District Council 21 consists of painters, glazers, and drywall finishers. We assist about 6,000 belly buttons, as we call them, navigate through the healthcare system.
And when you said, it took me the longest time to figure out what a glazer was. What's a glazer?
A glazer is a glass worker. It's really amazing work. Yeah, they're the guys you see hanging off the sides of buildings, replacing windows.
It's funny to me that the painters union and the glazer, like the paint and then the glass, they don't necessarily go together, but I guess. And then drywall finisher. So those are the guys or gals. I shouldn't be sexist. Those are the guys or gals that are preparing walls, I guess, with drywall. Okay. And if you've ever seen one of them work, it is amazing how fast and efficient they are at putting the spackle on. I've seen some of them. It's amazing. Okay, so you have 6,000 belly buttons, and are they based? Tell me where geographically they are.
Geographically, they're located in Pennsylvania, New Jersey, and parts of Delaware.
Okay, so in the tri-state area, and there's 6,000. You have two nurses. You and Heather split the really the acute and the complex patients. So again, Steph, to you, tell us what that looks like.
So over the recent year, we realized that our members have more of an acute need at DC 21. Their average age is about 33 years old, so a lot more acute needs than the chronic.
Right.
So Heather and I, in the morning, we look at who's in the hospital, who has doctor's appointments, and we kind of just divide and conquer, depending on who has what scheduled, and geographically what works best for both of us.
Right. So covering a tri-state area. So Heather, you're in one section and Steph, you're in another. So is that how you typically divide the patients?
We try to do it that way, yes. We also do it as if one of us was engaged with someone in the past and they are now hospitalized, regardless of where they're located. We'll try and continue the continuity of care in a sense where if you were engaged, then you normally typically go and see the one you were engaged with.
That makes sense. Yeah, you wouldn't want a stranger coming in. So, Steph, tell me we've been with DC 21 for a lot of years, I think, with the MCC program. How long has it been?
We have started our 9th year.
Wow. Gosh. Yeah. And I remember Rebecca was the original, the OG
She was.
MCC
Yep.
coordinator. That's pretty cool that we've been there so long. And I think that Mike Prevatira has he been the administrator since you guys were on the fund?
I believe he has, yes.
Yeah. Wow. That's really cool. They're a great fund, and I didn't realize they were so young in terms of their average age. So to your point, probably not a lot of diabetes, not a lot of high blood pressure, maybe cardiac disease, more the acute injuries that happen. Heather, what are some of the things in the last couple of weeks that you've dealt with?
Recently, like I went this morning to see someone who was in an uncontrolled AFib, which he discovered while working. I saw someone who had a heart attack. And yesterday I saw someone who was in liver failure. Wow.
Those are some pretty heavy issues. How about you, Steph? What are you seeing?
So recently I actually had a trauma case from a guy who was actually working in his home, not at work, and fell off a ladder and had lots of injuries from that. I also had a recent heart attack, a recent stroke patient.
Wow.
And then a lot of musculoskeletal injuries with these guys as well.
Yeah, we do see a lot of that.
Okay.
Particularly shoulders.
Yeah, some of heart attacks. You both mentioned heart attack. Heather, you were saying AFib. Given the relatively young average age, I would be surprised to see so much cardiac, but glad to have you on that. So let me talk a little bit. So painters, glazers, and drywallers, as a rule, when you think about their jobs and the jobs that they're doing and the work sites that they're on, Heather, are there any kind of unique, I want to say challenges or unique considerations that you have when you think about the members that you're working with, like what they're dealing with on the job site, maybe environmentally?
Yeah, I think that's our biggest concern is what they could possibly be exposed to at work. A lot of our members do work in old buildings, so they're definitely probably, at risk for being exposed to different things.
And in terms of asbestos and toxins and stuff?
Yes.
I just think about the paint, period. Even when I paint my house, or, when you open a can of paint, I know it's come a long way, but it's still synthetic and it's still giving off, I want to say noxious fumes, but certainly giving off fumes. I didn't hear you say anything, either of you say anything about respiratory. Are there any concerns from the union side? Do they do any sort of testing for respiratory disease?
They do. DC 21 offers them what's called a lung scan, which is a cancer screening with a low dose, basically a low dose CAT scan, which is very low dose radiation. So it's safe to be done every year. The fund pays for it for members, and actually their spouses can get it as well.
Wow. And what's that test confirm, or like what's it ruling out?
It basically looks for anything suspicious, nodules, infection that could potentially lead to a possible cancer diagnosis.
Okay. Have you ever worked with a patient who had one of those that was positive for cancer?
I have, actually. I had a member who got his lung scan. A small area was suspicious. So we went and saw a few specialists. We saw a pulmonologist. We actually saw a CT surgeon. Ended up having to go see a medical oncologist and radiation oncologist.
Yikes.
And finally got the diagnosis of small cell lung cancer.
Oh. How old was this guy?
He was in his mid-50s.
Oh. And he had been working as a painter?
He was a glazer.
Glazer. Okay.
So
Did he, I have to ask, did he smoke?
he was
Mm,
a smoker
okay.
as well.
Yeah. So like, which is, the chicken or the egg type of thing.
Correct.
But, okay.
Correct.
So go ahead. I'm sorry.
So to make a long story short, he went through a long course of treatment of cancer and radiation. And every appointment we went to, whether it was the oncologist, the pulmonologist, the same message we kept receiving was how lucky he was that he caught this so early. Because with a diagnosis of small cell lung cancer, you don't usually catch it this early. Usually it's actually already spread. So after his course of treatment, scans later, I can say now that he is actually cancer free.
Oh, congratulations.
Yes,
That's
yes.
wonderful.
And, we credit that to the lung scan.
Wow. So was that his first lung scan?
It was, yes.
Wow. Kudos to the union for offering that as a screening tool, because knowing that their members may be more at risk for lung disease, not just cancer, right? Respiratory issues. Kudos to them. We were at a conference, I think it was last week, and there was a lot of talk about screening for cancers early, that if you can catch it in the first stage versus stage 4, when it's spread to other parts of the body, that it's better for the patient for sure, because there's a better chance of a cure, and it's more effective use of money to treat someone rather than at stage 4. So again, kudos. A little, what's it, Benjamin Franklin, a penny wise, pound foolish. So if you get the screening done sooner, in this case, for instance, for your guy, turned out well. So
yeah, it's a great benefit.
Great. Yeah. Heather, how about you? Like, are there any, is there a story in terms of screening, or what kind of stories in terms of the exposure item? Again, I mean, there's everybody in our world's going to maybe have high blood pressure and maybe diabetes, but in terms of any issues, have you come upon any members that have a story that's be compelling?
So for me, the one story that always sticks out is not long after I started, I received a phone call from a gentleman who had been seeking treatment, or I should say care, from a local hospital. And he had been seeing this neurologist for over a year at that time before he called me. He called me with concerns that they weren't maybe testing him for what he should be tested for. He had tremors in his hands, and that's how it originally started. And then he was treated with medication for the tremors, but then it got worse. He started to have numbness and tingling in his feet, both feet, which altered his gait a little bit. So when he called me, he wanted to know what I thought he should do next. He kind of just wanted my advice. And at that time, I offered getting him a second opinion, which I did. He agreed to do. So within 5 days of him calling me, I had him at another neurologist, who then sent him to a neuromuscular doctor and had him completely worked up within 12 to 15 days. He had a bunch of testing done. They said he had a very rare syndrome, and within a month, he was receiving proper treatment. He gets infusions weekly. It has completely slowed down the progression of his syndrome. He'll never be cured, and he knows that. His whole goal in life was to try and slow it down, because he's young and he has kids and he doesn't want to stop working. So at this time, he is working, not out in the field, but he is able to go and work in an office part-time, even though he still is a little weak with his hands and his tremors. His gait isn't back to complete normal, but it's definitely has improved over, I would say, it's been a year now since he's been working with me.
Wow. So he had been under care for a year, or at least a year, you said?
Yeah, it was over a year at that time.
Over a year. And it was getting worse. And so thank God he called you. I mean, I think that's probably the strength of the relationship that we've had there over 9 years, that members know about us, or at least hear about us, or maybe he's talking. What was the prompt? How did he know about us? Do you know? Did you ask him?
He said someone from the union told him about us months prior to him actually calling.
Oh, wow. I wonder what
That he was
nervous. Okay. Wow.
Yeah, he was nervous, I guess, to find out maybe, it was worse than he originally thought. I don't know. He said he was nervous about a lot of things, but it finally got to a point where he said enough is enough, and he knew he needed to get more work up. And that's when he finally reached out to me.
Wow. So just by getting him a second opinion at, was it an academic medical center?
Yes.
Yeah. I mean, look, I think we're lucky to live in a region that has a lot of academic medical centers, and not to belittle community hospitals, but sometimes in this case, for instance, you need a little bit of more, I guess, oversight, or at least curiosity as to what it was. So it's not curable, but it's treatable.
Correct. Yep.
And they can stave off the progression of it. It's kind of like MS, I guess, right?
Similar,
in a
yes.
way. Yeah.
Mm-hmm.
So Heather, do you think his diagnosis had a relationship to his work?
Honestly, I wouldn't be able to say yes or no to that question. I can tell you when we went on the first appointment, the physician did ask him his occupation, and he never made a correlation between the two. We were also told in that appointment that this syndrome is very rare and just recently got a name. So maybe there's not enough information out there to say whether it is or isn't. But the one thing I do know, it does affect men more than women.
And so he's back to work. It's amazing to me that we hear these stories all the time about patients kind of going along and I guess not being assertive in their own care or their own treatment because they don't know what to do. Unfortunately, DC-21 has had us for so long that I'm glad that they thought of you. Jeez. Yeah. And he's still engaged with you, or he just pop in from time to time?
No, he's still engaged with me because he's still, getting treatment weekly. Sometimes they'll space out his treatments depending on how he's doing, and he will get them once or twice a month instead. So I still go on all his follow-up appointments.
Okay. So I'm going to ask you both a question. I know that it's been some time, Steph, for you, but Heather, more recently, you were in the hospital during COVID, and you've come out to work at Guardian Nurses for over a year. Tell me, how does it feel to go into the hospitals as a Guardian nurse and interact with the staff, knowing that you more recently just came out of the hospital?
I think coming out of the hospital after enduring COVID, I've learned that you need to be more patient with nurses and staff going in as a Guardian nurse, because they're short-staffed and they're running around like crazy. So I feel like as a Guardian nurse, I've learned to not necessarily need that instant gratification when I ask to speak to a nurse, that I know they're busy. So I think that helps because I understand what they're going through.
Mm-hmm. Yeah, for sure. Yeah, that's good. And we've all heard about the short staffing. It's a kind of a new epidemic. Short staffing. No nurses in the hospital, and also with doctors too. Steph, how about you? I know it's been a little longer, but what when you go into the hospitals now, what's your how do you feel about interacting with the staff?
Well, I think I can say the same thing. It's so different from when I was at bedside. The nurses, you can just feel that they're overworked. They're a lot younger. And I think a lot of the nurses my age, kind of moved on. The pandemic just really affected nursing. So those that were able to move on did, and now you have these younger nurses that don't know any different, and I think it's really taking a toll on them.
So they've come in after COVID. It's kind of hard to believe that we can say after COVID.
Right.
Yeah. And they don't know any better, right? That there might have been a different work environment before 4 years ago.
Correct.
Yeah, I was just curious what your experiences were. So oftentimes when we're closing the podcast, I like to ask the guests, what lesson of the story that you shared with us, what lesson would you like our listeners to take away from your story? So, Steph, I'll start with you, based on what you told us.
Definitely, I think my lesson is how important preventative screenings are. So whether it's the lung scan like my patient had, or your mammogram or your colonoscopy, just take the time to get it done.
Yeah. Well, that is wise advice, Nurse Wimmer, because and it's so, for us as nurses, I mean, look, we're not 100% either on our screenings, but it's so strange to me that patients don't want to get screened because obviously there's different schools of thought, right? I don't want to know. I'd rather not know. I can't take off from work.
Right.
It's too much trouble. I can't get an appointment. There's so many reasons. And I think certainly if we could change the world, I think I'd make it easier for patients to get screenings, like have them all done in one day, have the screenings brought to them.
That would
Like
be
it's
nice.
right.
I think
Right.
for our members too, it's unique because if they take a day off to go get a screening done, they don't get paid. So we
Right.
run into that a lot with our members, giving us, I wouldn't say pushback, but it's almost like, well, I can't do that because if I take a
Right.
day off, then I lose pay, and
Right.
everything's based on hours. So they get worried about taking off even for appointments that they need to go to, not even just preventative screening.
Right. If they have a doctor, like in your case, your gentleman was, not working. He's not getting paid.
Right. So
Yeah,
a lot of times
go ahead.
they'll ask us to make appointments either first thing in the morning, as early as possible, or after 3:30 in the afternoon, so that they don't have to miss a day of work.
Oh, okay. No, that makes sense. The problem is getting the appointments, right? But I mean, 3:30 isn't so bad. But the healthcare system, doctors' offices open up at 8:30, which is not really the start of their day. They're there much earlier.
Right.
Yeah.
And they close at 4. I find it harder, especially the specialists. They don't stay open late anymore. They're done at 4.
Right. Yeah, I've been on accompaniments before, and if it's a late appointment, even if it's like 3:00 or 2:30, and you come out and there's nobody there, it's everybody's left. And it's like, wait, hold on. Yeah, I was just down at Penn in the pulmonary department, and I came out and there was nobody there. I was like, oh, I guess, all right, see ya. So I think that the screenings, if we could change the world, that would be one thing that I would do, is to have some sort of efficient screening so that patients didn't have to take time off, or we could come to them and it would be, I mean, I know there's a mobile mammography, but that's not going to help a lot of painters, and if they're males. Heather, how about you? What's the lesson that you'd like to share?
I think for me, with the story I shared, it's always trust your gut. If you feel like the care you're getting isn't enough or appropriate, you should always seek a second opinion, and always, follow that intuition you might have when it comes to your own body.
Boy, that's a good one. At what point did your patient feel like maybe something was up? Like, what did he acknowledge that maybe it was like 6 months into it, or like when did he realize it?
He said around between like 10 and 11 months, where he was, going back for like a third, fourth follow-up, and it was the same information was being provided to him at the appointment. Nothing was changing. They just kept telling him to take the medication and follow up again in 3 months.
Oh, I can appreciate that, having a similar, not a neurological issue, but certainly something that I'm dealing with. So it's frustrating. It's like, I just want to get an answer. I want somebody to be curious about this, right? As curious as I am.
Right.
Right. I want somebody else to share my curiosity and want to get to the bottom of it and help me, right? Like, help me, minimize my symptoms. And it feels like there's very little time for that in appointments. Yeah. Well, I appreciate it. Is there anything else that you think I missed about DC-21 that you'd like to bring to light?
No, I think we hit on it.
Okay. Yeah, I think I do want to, Steph, to your point about the screenings. A couple of years ago, I know Rebecca worked with Mike, who was the administrator there, and I think he got a similar lung scan, didn't he? Didn't he get? Oh no, he got the heart scan, and
He
they
got the
did
heart
find,
scan, which
right.
ended up revealing a lung cancer as well. Yeah.
Yeah, which was, terrifying, but also early on, and he had surgery and he's cured and has remained cancer free. So, to your point, just another arrow in the quiver to say get your screenings if you can. So thank you both for joining me this week. I enjoyed talking with you, and I hope that you enjoyed it as well.
We did. Thank you,
Thank you, Betty.
You're welcome. All right, take care.
Bye.
Bye-bye.
Bye-bye.
Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.